All right. So getting started just a minute late. We had a bunch of people joining and we wanted to make sure that they made it in. So just start by welcoming everybody here. Happy to have you on another Bill Flash webinar. This one's very interesting. This is going to be a fun one. Modern practice management, connecting care and technology. A lot of fun, interesting things we're going to talk about today. So to get started, just to let you know, I'm Peter Haas. I'm the VP of Business Development here at Next Trust. I broke into the healthcare scene many years ago, working in the long-term care and rehab world. And it happened to be in a time when we had to go from using a lot of paper to digitizing everything. And that's actually some of what we're going to talk about today. But before we get into this, I know there's going to be some questions that come up, especially because of the content. But if you could just hold on to that question until the end, either hopefully I answer that question throughout the webinar. But if not, we're going to have some time set aside for Q&A. So with that, let's get into it. So what are we going to be specifically discussing today? So first, we're going to discover how technology is changing the game in healthcare, covering everything from its evolution over time to the hottest trends right now. We're going to dive into the world of telemedicine and see firsthand how it's revolutionizing how patients interact with their healthcare providers and receive treatment. Third, we're going to take a closer look at the influence of digital tech on making billing smoother, upgrading payment systems, and optimizing financial processes in the healthcare industry. And last, we'll get a sneak peek into the ways that technology is upgrading different facets of managing a practice, like making patient registration a breeze, simplifying appointment scheduling, and keeping records in tip-top shape. So with that, here we go. So when it comes to boosting patient outcomes and making healthcare better, you can't ignore the power of technology. It's not just a game changer, it's totally shaking up the whole healthcare system or scene. Whether it's digitizing patient records or bringing telemedicine into the mix, technology is all about making things smoother, faster, and more tailored to each person. It's like the secret sauce for innovation, pushing things forward and giving both healthcare pros and patients the tools they need to thrive. So let's take a stroll through the evolution of healthcare technology and dig into how history has totally transformed the way we handle things like practice management, billing, and payments in the healthcare world. So if we look at these historical milestones in practice management tech, electronic health records. We waved goodbye to the days of paper records and said hello to electronic health records, making data management way smoother for healthcare providers. Accuracy and accessibility got a major upgrade. Then, healthcare information systems. With the birth of comprehensive information systems, practice management got a serious boost. Now coordinating appointments, resources, and patient info is a breeze. And third on there, medical billing software. The advent of automated billing. The introduction of medical billing software made billing processes a whole lot easier, slashing errors and supercharging the efficiency of financial workflows. Side note, while we could say all of this happened in this span of, say, 70 years, because the 60s is really when EHR started. That was when the Mayo Clinic in Rochester first adopted it. And then in the 70s, we had CoStar, Promise, TMR, Help, all of those. Arguably, the biggest changes have taken place in just the last 15 years because of meaningful use and the Affordable Care Act. So crazy that it's changed so much in that short span of time. And thanks to these cool tech upgrades, there's a whole new vibe in the world of medical billing and payments. What have we got? We've got streamlining billing operations. Because of such digital solutions, billing has become a breeze. We're talking improved accuracy, faster claim processing, and less admin hassle, less burden. 2, we have enhanced payment systems. Modern payment systems are teaming up with tech to make transactions super secure and hyper convenient. Patients and healthcare pros are both feeling love. I mean, who doesn't want peace of mind teamed with simple process? I think that's a no-brainer. Number 3, optimizing financial flows. So tech-driven financial workflows are giving the whole revenue cycle management a turbo boost. It's all about transparency and efficiency, creating a financial ecosystem in healthcare practices that just works better. World of healthcare technology right now is like a whirlwind of change and innovation with crazy advancements and game-changing trends. So let's zoom in on what's hot in the current state of healthcare tech. Going digital. So healthcare has gone digital big time, right? We're talking EHRs, telemedicine platforms, fancy diagnostic tools. It's the whole new world. Interconnected systems. To steal an old phrase, teamwork makes the dream work. Practices are teaming up with tech that talks to each other. Digital payments and health record systems make communication a breeze and boost the patient experience. And we've talked on a myriad of webinars about the patient experience and being customer-centric. And in fact, here we go again, patient-centric solutions. It's all about them. It's all about you. It's about putting patients in the driver's seat. The spotlight's on patient-centric tech that gives them the power. Think self-monitoring, health tracking, and payment experiences that are smooth as butter. So if we look at what's going on in patient care with some interesting stats and trends happening right now. The telehealth takeover. Telehealth is having a major moment. Virtual consultations and keeping tabs on patients from a distance have skyrocketed, breaking records. If you look on the screen, it's grown over 50% since the start of 2020. Obviously, there were some factors, but that aside, it is where it is. AI is getting smart in diagnostics. Artificial intelligence is the superhero of diagnostics these days. It makes big moves, helping doctors assess medical conditions faster and more accurately than ever. And then let's look at this last one. By 2025, 1 in every 3 adults in America will wear a fitness tracker. Really interesting. So this is the wearable health tech. It's the new cool. So wearable devices and health apps are stealing the spotlight. So they're all about proactive health vibes, letting people keep an eye on their well-being and manage their health like pros. So what's behind all of these changes? There are some key players making waves. Tech titans in the health scene. So big names like Google, Apple, Microsoft, they're diving headfirst into healthcare. They're using their data smarts, cloud wizardry, and tech prowess to shake things up. Startup superheroes. There's a whole squad of innovative startups turning the traditional healthcare game on its head. They're bringing fresh ideas to the table in telemedicine, digital therapeutics, and healthcare analytics. And then I said it, so might as well say it again. Teamwork makes the dream work. Tech companies, healthcare pros, and pharmaceutical bigwigs are joining forces in epic collaborations. They're shaping the landscape, sparking innovation, and sharing resources like the ultimate dream team. In this ever-changing scene, healthcare tech is all about mixing things up. Innovation, data-driven decisions, and teamwork all aimed at giving us healthcare that's easier to access, super efficient, and totally focused on the patient. So, as the focus shifted towards making patients' experiences better, along came telemedicine. Interesting stat on the screen. Over half of clinicians believe they deliver more effective treatment and follow-ups via teleconsultations. So telemedicine, it's the current aha of healthcare, totally changing the game and shaking up how we get medical services. So, but with that said, we probably need to dive into the ups and downs, because there's going to be both pros and cons, of bringing telemedicine into the modern scene. So what are the benefits of telemedicine in modern practices? Number one, you can get care anywhere. Telemedicine is like the magic key that unlocks access to healthcare from anywhere you're at. No matter where you are, you can connect with healthcare professionals. That's amazing. Number two, money matters. Virtual check-ins aren't just convenient, they're budget-friendly too. So less travel and fewer overhead costs means savings for both the folks giving the care and the ones receiving it. Number three, healthier outcomes. Thanks to telemedicine, quick interventions can make a big difference in the life of a patient. It's like having a superhero on speed dial when you need medical attention pronto. So if those are the benefits, they sound great. So let's look at some of the barriers. What are some of the challenges? So number one is going to be tech hurdles. And looking at this from the patient side, not everyone is tech savvy, and some might not even have reliable internet. So that can be a huge roadblock for some individuals that otherwise would participate. Number two, regulatory and reimbursement issues. Navigating a plethora of rules and regs so you can get paid can feel more like a puzzle that needs solving than medicine. It's outside of the norm of what we're used to or comfortable with. It's different. Number three, keeping the connection strong. Building a solid bond between patient and provider is trickier in the virtual world. That's just a reality. It takes some extra elbow grease and communication for it to work right. Telemedicine is changing the game in healthcare. It's opening up unprecedented opportunities to make things better for patient and practice alike. But currently, it's not all smooth sailing. So while about 80% of us have given it a go at least once, it's still worth weighing out the pros and cons for your individual practice. You never know, it could be the goldmine of health and prosperity that you're looking for. So, patient engagement, getting patients engaged is a game changer for giving top-notch personalized care. So you might be thinking that face-to-face is still the way to go, because we just talked about how face-to-face is still very important in terms of them being remote are harder to communicate at times. But that said, just like many of us have become comfortable with remote work, people are oftentimes looking for digital avenues to engage with their healthcare providers. So to not sound confusing, there are aspects of both worlds that we need to be focusing on. Now, if we're talking about the digital side, the integration of tech plays a central role in enhancing patient engagement, reshaping the way healthcare providers communicate and interact with their patients. So that's the part. I hope that my last comment wasn't confusing. It's all about the engagement and the communication. So how do we engage with patients digitally? Well, number one, digital communication channels. Technology provides a multitude of ways to connect with patients, like secure messaging, emails, patient portals, which lead to real-time interactions. It's a really easy first step to dip your toes into the digital waters, if you will. Number two, remote monitoring and health apps that we just talked about. Wearables and health applications empower patients to actively participate in their healthcare journey, allowing them to monitor health metrics and share data with you or the healthcare providers. Number three would be digital payment plans. Offering flexible digital payment plans through online platforms allows patients to manage their financial obligations their way, according to their needs. So that's the digital piece. So communication, monitoring, payment. So diving into digital payment plans is just one way to modernize your billing process. If you're still living the paper billing life, you might nod along with some of these common challenges that are faced. Number one, manual data entry and errors. The traditional billing game means a lot of manual data entry. That opens the door to errors and can slow down the whole billing and reimbursement process. Number two, paper-based documentation. Relying solely on paper-based documentation can lead to inefficiencies, making it challenging to track billing status and share information among healthcare staff. Number three, delayed claim processing. The traditional billing model can result in delays in claim processing, which impacts revenue cycles and thus the overall financial health of the practice. So by transitioning from traditional billing methods to digital solutions, practices can overcome challenges, improve accuracy, and streamline operations. So what are these solutions? Boom, there's number one on the screen. Integrating electronic health record systems into your workflow brings a seamless harmony to patient data, slashing errors and ramping up accuracy in billing processes. They're not a trend. EHRs are the gold standard at this point for documenting patient info and care details, turning the once manual billing tasks into an automated breeze. So this smart software isn't just a time saver. It's, as mentioned, gold standard, game changer in record keeping, providing medical billers with a centralized source of information for filing claims. EHRs not only support patients and providers, but also offer several advantages for the medical billing process, including creating more accurate and timely patient records, enabling coordinated access to patient information, improving record completion rates and legibility, and reducing the risk of duplicated interactions. Automated billing software. So utilizing automated billing software significantly streamlines the entire invoice workflow, from the generation of invoices to their delivery and subsequent tracking. Automation also minimizes manual intervention, reducing the likelihood of human error associated with data entry, calculation, or documentation. BillFlash integrates with hundreds of billing applications, letting you work within a single platform to automate sending statements while simplifying your team's workflows, regardless of the EHR or EMR software each individual practice uses. Online payment portals. Offering online payment portals provides your patients with convenient, secure options, accelerating payment processes, and improving the overall patient/payer experience. In fact, 91% of consumers prefer electronic payment methods for medical bills. BillFlash offers online payment, which enables patients to effortlessly log in, pay their bills, and manage their accounts. This feature not only grants access to various billing and payment options, but also provides comprehensive transaction history. Computer-assisted coding. Computer-assisted coding, or CAC, a form of artificial intelligence employed in medical billing, has successfully addressed initial concerns regarding elevated error rates and time consumption. Contrary to early worries, CAC has proven to be remarkably intelligent and valuable within medical billing software. Users of CAC have reported favorable outcomes, with 65% noting improved billing quality, that's huge, and 68% reporting heightened productivity, also huge. Beyond CAC, various other AI applications are now effectively integrated into medical billing solutions, encompassing task automation and the identification of potential errors. This underscores the affirmative impact of AI in streamlining processes, enhancing accuracy, and boosting overall productivity in the realm of medical billing. Hello, AI. Cloud-based billing systems. Cloud-based billing systems such as BillFlash facilitate real-time access to billing information, promoting collaboration among healthcare staff and enhancing efficiency. Financial workflows in healthcare. Okay. Interesting statistic. 81% of healthcare leaders are committed to using technology to improve the revenue cycle management performance. I say interesting because that number should be 100%. If we're not at 100% yet, if our practice isn't there, we need to take a real keen look introspectively and get there. Healthcare organizations are actively embracing a transformative shift toward digital platforms, stepping away from traditional paper-based financial workflows. This sweeping transition marks a pivotal moment in the industry's evolution. By incorporating digital technologies, organizations are automating a wide array of financial tasks, spanning from billing and invoicing to claims processing. This automation not only significantly mitigates the occurrence of manual errors, but also accelerates the pace of overall financial operations, exactly what we're looking for. But wait, there's more. To further heighten efficiency and coordination, there's a growing trend of integrating financial systems with electronic health records, the EHRs, and practice management platforms. This integration facilitates a seamless flow of information across the healthcare ecosystem, fostering improved coordination and data consistency. As healthcare continues its digital metamorphosis, the integration of these systems becomes a key strategy, promising more efficient and accurate financial workflows. I just want to say that one more time. It becomes a key strategy. The shift to digital is making waves, especially when it comes to revenue cycle management. That's where the real magic happens. Let's read on the screen. 36% of organizations still use Excel spreadsheets to track and analyze payer denials. If you are in that 36%, it could be a very good time to evaluate how efficient your revenue cycle is. As I already mentioned, the move to digital financial workflows, it's not trendy. It's a game changer for making revenue cycle hyper efficient. By cutting down on delays and boosting cash flow, automation in billing and claims processing systems is like giving your revenue cycle a turbo boost. Quicker submission and processing means less time between offering services and cash hitting the books. And here's the real gem. Digital financial workflows are all about precision. They kick errors to the curb in coding, billing, and documentation, ensuring you dodge those reimbursement hiccups, which is what we all are looking for. The digital transformation in financial workflows is not just an effort to modernize, it's a strategic approach to optimize efficiency, enhance accuracy, and ensure financial sustainability in the dynamic landscape of healthcare. It's not just to modernize, it's to optimize. I hope you picked that up. By leveraging technology, healthcare organizations can navigate the complexities of financial management with greater precision and transparency. If you're searching for where to get started, try a few of these strategies. Number one, on the screen, data analytics for decision making. The implementation of cutting-edge data analytics tools empowers healthcare organizations to delve into financial trends, facilitating informed decision making, which is what we're all headed towards, informed decision making. By harnessing the power of data, organizations can strategically optimize revenue streams, identify areas for improvement, and enhance overall financial performance. Number two, patient financial education through digital platforms. I know that's a long sentence, but employing digital platforms for disseminating clear and accessible financial information to payments is a modern strategy that promotes understanding and transparency. This not only reduces the likelihood of billing disputes, but also contributes to improved overall patient satisfaction. And by the way, as a reminder, when we have patients who are satisfied, especially with the billing process, which is their last interaction with us until the next time, is key in patient retention. Utilizing user-friendly interfaces and interactive tools enhances the effectiveness of financial education efforts. 3, regular audits and compliance checks with digital tools. Incorporating regular audits and compliance checks into financial processes is essential for maintaining adherence to regulatory standards. The integration of digital tools in these processes ensures efficiency and accuracy. Automation, data-driven insights, and real-time monitoring through digital platforms enable medical practices to minimize the risk of financial penalties while staying compliant with evolving healthcare regulations. This modern approach enhances the integrity of financial operations and supports long-term sustainability in the healthcare landscape. I hope we all understand the value of these tools in staying up to date with the regulations that we face and staying compliant. For 61% of patients, as seen on the screen, having access to online appointment scheduling is extremely or very important to them. In the healthcare scene, the infusion of digital tools is causing a real shakeup in how things run, right? Making both operations and patient experiences way better. So let's break it down. First off, digital tools for patient registration are the unsung heroes of efficiency for us. It took away all the staff time that was dedicated to it. It's that you could consider it the backstage crew streamlining all the admin stuff that we have. By automating the collection of patient information, these tools kick paperwork to the curb, they minimize errors, and they make the workflow super smooth. Plus, the digital registration process ensures top-notch accuracy, keeping patient info up to date for seamless communication between healthcare professionals and the patients. Bonus, it's a time saver, as I already threw out there. Patients can fill in registration forms online before showing up, saving precious minutes during in-office visits. Now, let's talk about the tech-powered appointment scheduling game. This is vital for cutting down wait times and optimizing the patient flow. These systems spill the real-time tea on availability, letting both patient and healthcare pro check out accurate scheduling info online. It's not just convenient, I would say it's imperative, it's vital for the patient experience. But wait, again, there's more. Automated reminders built into these systems are the secret sauce for slashing no-show rates, keeping appointments on track, and operations super slick. That's huge. By weaving technology into practice management, we're not just optimizing operations, we're turning the patient journey into a breeze. From the very first registration steps to high-tech appointment scheduling and top-notch record keeping, technology is the MVP in giving healthcare practices a modern makeover that benefits everyone, providers and patients alike. Future trends. The future of healthcare is on the brink of a transformation fueled by emerging technologies, bringing the promise of not just enhanced efficiency, but a shift towards more patient-centered care. Oh, there it is again, patient-centered care. Looking down the road, the future of practice management could unfold with these key elements. Advanced telehealth solutions. Brace for the continued evolution of telehealth. Picture seamless integration into practice management, making routine consultations, follow-ups, and even preventative healthcare a virtual breeze. Predictive analytics for resource optimization. The crystal ball of predictive analytics will set up, foreseeing patient demand, fine-tuning resource allocation, and giving an efficient boost to the overall practice. Personalized patient journeys. Practice management systems are gearing up to get personal. Using data-driven insights, they'll tailor patient experiences, customizing care plans, communication, and overall engagement. And last, but certainly not least, we have enhanced cybersecurity measures. With the digital wave getting bigger, the future of practice management is shining a spotlight on robust cybersecurity. It's all about safeguarding patient data and ensuring privacy compliance. As we navigate this future, these emerging technologies are set to shake up the healthcare landscape even more, bringing more innovative solutions that will redefine the way practice management operates. We just have to be ready for it. From crafting personalized patient experiences to diving into advanced analytics, the future of healthcare tech is packing some pretty exciting possibilities for boosting patient care and operational efficiency. So, as we conclude today's webinar, I'd like to take a moment to emphasize the transformative value that Bill Flash services bring to your medical practice. In an industry where efficiency and reliability are paramount, Bill Flash stands out as a beacon of innovation. Our cutting-edge solutions are designed to streamline your billing process, ensuring that you're not just faster, but also more accurate and secure. We understand the unique challenges faced by medical professionals. We've been sharing the trenches with you for over 2 decades. And our commitment to continuous innovation means that we are always ahead, providing you with the tools that not only meet your current needs, but also anticipate future trends in healthcare management. With Bill Flash, you're not just choosing a service, you're embracing a partnership that grows with your practice, enhances patient satisfaction, and ultimately boosts your bottom line. So just want to say thank you for joining us today. Hope that you found the information informative and beneficial. You can certainly schedule a demo at any time at billflash.com, whether you are a prospective user or a current user of the software. If you have any questions, that's a good way